when it comes to verbal skills training for our team regarding successfully dropping PPO plans. For example, we might do some verbal skills training around having the heads up conversation with our patients. We might do some verbal skills training with our team members that are on the phones. So they're trained when someone calls in and says, do you accept my insurance? And we do a little bit of training with that, and doctor checks it off his or her list thinking they're done. And actually that's not the case. It's like, Naren, imagine that you use the marathon example. Imagine you make a commitment to run the marathon.
Yes.
Let's say it's coming up in 4 months. And you say, I got 16 weeks to prepare for this marathon. There's a lot of 16-week training programs to run a marathon. Mm-hmm. As a marathon, I'm familiar with this. And imagine that you start out gangbusters. The first week you do great. And then it falls off the map and you don't have time. Work got in the way, family got in the way, travel got in the way, everything gets in the way. And then how would you do in the marathon if your training consisted of that first week, and then 15 weeks later, it's time to run the marathon? You say, well, you know what? I committed to do it. Let's go do it. That will not be a good experience.
Yeah. I mean, more than likely, you're not going to even finish.
You're not going to finish. The likelihood that you would finish, or if you did, you're going to be one of those that says, never again. I'm never doing one of these again. This was torture.
I will never finish, Gary. If I haven't trained for like 16 weeks religiously, there's no way I'm going to finish.
There's no way. Verbal skills training, it's not one and done. But you have to do it continuously. You have to do it a number of times. You have to revisit it to make sure that we're up to speed again. So verbal skills training is not one and done. Don't let that be one of the things that happens to one and done, because very often I've listened to calls where the team has been trained on how to answer the phone call. Do you take my insurance? And then I listen to calls 2 months later, and the call comes in, do you take my insurance? And the answer is, oh, we're not a network with any plans, which, by the way, is the wrong answer. So there we go again.